Hello, everyone. This is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. Welcome to our webinar today. So on today's webinar, we are talking about peptide therapy for weight loss. This is our physician-assisted weight loss program utilizing semaglutide and other peptides. As I'm speaking, and I'll be speaking for about 20 minutes or so, please add in any questions that you have, and I will certainly answer them as we go along. As I'm talking, outside of questions, if you want to contact us after the webinar, in the chat section, you can see all the different ways you can contact us, either through phone call, email, obviously through our social media sites. And then if you want to schedule, you can actually schedule directly through our scheduling app as well. So today's talk, we're talking about our signature weight loss program, which includes utilizing peptides, lipotropics, and health coaching. Of course, everyone already knows this, but we know that being overweight and obesity is really a humongous problem in our world currently, not just in America, but really the whole world. Affects so many different things, our cardiovascular health, metabolic health, immunologic function, and just our overall well-being. Really, hundreds of millions of people are estimated to be obese throughout the world. In the United States, it's roughly 42% of adults, and children, it's almost 10%. And so we're really looking for a better way, a safer way, and a more reliable way to help reduce this issue for our population as well. So the health effects of obesity are very wide. They can increase the risk of so many different issues. Every day in my practice, right, I mean, we see tons of musculoskeletal issues, and we know that excess weight can increase the risk of pains and arthritis in the knees, the hips, ankles, and lower back. Certainly, we know about the cardiovascular consequences, whether it's high blood pressure, higher risk of heart disease, sleep apnea, metabolic effects like type 2 diabetes, high blood pressure, even immunologic implications such as higher risk of infection. It can worsen certain autoimmune conditions, including psoriasis and psoriatic arthritis. And there are also some associations between weight and cancer risk as well. So we need some better options for weight loss. We know that obesity presents some significant long-term health issues, and so we need better options here. There are limitations to traditional methods. Diet and exercise are absolutely essential, but realistically, they're not adequate for many people. The conventional weight loss strategies are useful, but they can sometimes be very limited or unsustainable. And in fact, there's a yo-yo effect where people get some benefit and then lose that benefit. And so we need better options. And the other thing we realize is that weight gain and the attempt for weight loss is much more complicated. In the past, it was really thought to be a willpower issue, and that's really flawed. It's really thought to have multiple other variables, including biological, psychological, and environmental factors that make it very complicated. And in the same way that we would treat, let's say, high blood pressure, diabetes, heart disease, kidney problems, we would treat it appropriately and significantly, not dismiss it. I think we've come to realize that weight loss is something that you really need to handle all the associated issues. So our weight loss assisted program is trying to provide a comprehensive approach to address obesity and improve overall health. In terms of goals of treatment, of course, there's weight loss, but we also want to improve body composition. That includes losing body fat, maintaining or improving muscle mass, and reducing visceral fat. The reality is that with weight loss, you can also lose muscle mass as well. That's pretty typical, and there has to be an attempt to try to prevent that from happening. We also want to improve your cardiovascular risk factors. We want to improve your overall metabolic health. We want to improve your exercise capacity if you're limited because of weight. Improving your eating habits is part of this as well, and actually the peptide treatments can help with that. These treatments can also help improve your immune and gut health, and of course also improve sleep and stress management. So there's really three different ways that diet can help with weight loss. And these are important because the peptide options can actually help with all these. So to begin with, it's just eating less calories, right? If your output of what you're doing, your energy expenditure is greater than your intake, you'll get weight loss. Then there's eating less specific foods, right? But the question is which foods, right? Right now in our modern life, we have such extremes in terms of what kind of diet habits people utilize. There's people on one extreme vegan, no oil diet, incredibly restrictive. And there's people who are straight up only carnivore, only eating meat. And these are complete polar opposites and extremes of what people can do in terms of dietary habits and that people talk about in terms of losing weight. So really, which one is really ideal for weight loss? We know that there's probably some common ground in the sense that I think it's hard to say, should you be only plant-based, should you only be meat-based? But I think we can all kind of reasonably say that there's certain types of foods everyone should avoid. Refined foods, overly processed foods, we know that. And I think anyone on every side feels like too much carbs is kind of problematic as well, and that there should be some diversity and mix of the diet as well. So a lot of organizations espouse the concept of the Mediterranean diet, which tends to be more vegetables, legumes. When it comes to meats, more chicken and fish, and certainly avoiding highly processed foods and refined sugars. And then lastly, there's eating during specific periods of time, right? That would be called intermittent fasting as an example, where you're eating for 8 hours a day and fasting for the other 16 hours per day. Intermittent fasting, we know, helps with certain variables of metabolic health, your blood sugar, even weight loss. There's questions about whether or not it's adequate in terms of improving heart disease, though. But again, I think common sense would say that we know that eating late at night is likely not good for you. And so certainly having some restriction is helpful. And so reality is when it comes to diet, it should be hitting all three of these things. You should be eating less than what your exertional output is if you want to lose weight. You certainly should be restricting some foods, and you certainly should be avoiding eating certain periods of time as well. And so all these are useful, and I think the peptide treatments can actually help with all these. So the peptides are naturally occurring molecules in your body that act as signaling molecules in the body. What does that mean? It means that these are proteins in your body that tell your cells what to do. All right. This is really how there's a very delicate and elegant interplay between how our body reacts to what it's experiencing, and then how it reacts to that. And so when it comes to your sort of hunger cycle, when it comes to food, your metabolic health, there is a very delicate interplay to that our body naturally handles that can become dysfunctional either as we age with hormonal changes or with dietary habits and routines. So there are a number of different peptides that are useful here. The most well known is called glucagon, like peptide 1 or GLP-1. Again, it's a naturally occurring peptide, gut hormone that regulates your appetite, insulin secretion, and energy metabolism. There are other peptide targets as well that are now actually available and that we are now utilizing. So these peptides, they have a key role in your glucose, your blood sugar control, and insulin secretion. So they have a very key role in diabetes, and they also have a key role in metabolic health and have been shown to give very significant and good results when it comes to weight loss. So these peptides are a game changer when it comes to weight loss. Semaglutide is the generic name for Ozempic and Wegovy. It is a GLP-1 analog that mimics the effects of natural GLP-1. So it has been shown to give a remarkable improvement in promoting weight loss and improving metabolic health. So it is actually approved by the FDA for both diabetes as well as weight loss. So how does it work? It improves your overall blood sugar control, pushing blood sugar into the muscles. It helps to reduce how fast your body is processing food in your gut so that you're not immediately hungry again shortly after eating. Because of that, it also helps to reduce your appetite. There's certain peptides that are associated with hunger, certain that are associated with satiety, and the GLP-1 analogs, these medications or these peptides, they help to reduce your appetite. So semaglutide and tirzepatide, those are the ones that are most kind of commonly being used right now. They essentially work by controlling your appetite and weight through a connection between your gut and your brain. Slows your emptying of your food from your stomach and your intestines so that you're not quite as empty as fast. It reduces your overall hunger sensations. It helps people feel fuller sooner so that you're not just continuously eating until you really feel full. And it overall reduces food cravings, food preferences, and thoughts about food. So the indications that are approved by the FDA include the following: type 2 diabetes and also chronic weight management in adults. So what's interesting is when it comes to chronic weight management, it includes for people who are considered obese. That means a BMI greater than 30. The BMI is not really a perfect measurement of weight or weight management, but it's one that is utilized in a lot of medical studies. And so it's the one that we're still utilizing. But what's interesting is this is also approved in people who have a lower BMI, who also have another weight-related possible comorbid condition. That means another condition that can be made worse by excess weight, including high blood pressure, diabetes, cholesterol, wear and tear arthritis, fatty liver, pre-diabetes, heartburn, PCOS, hypogonadism, and asthma. So tons of different indications where this can be relevant in people who still need to lose some weight. So possible future preventive indications, maybe even in cardiovascular disease, preventing prediabetes, neurodegenerative disease. There's some evidence is actually helpful in some of those conditions. Anti-aging. What really causes aging? Is it because your metabolic health is getting worse over time? And then, of course, improving metabolic syndrome, or preventing metabolic syndrome. I see a lot of patients who have an early chronic inflammation autoimmune condition, and maybe their blood pressure is borderline, maybe they've got a tiny bit of fatty liver. They're not quite at metabolic syndrome, but you can tell that on this path, if they don't make some significant changes, they'll be at that level. Metabolic syndrome basically means that you've got diabetes, fatty liver, high cholesterol, and then eventually heart disease and those kind of conditions. So exciting possible future indications as well. So our peptide treatment protocol, this is the one that's FDA approved. Essentially, you're doing a weekly subcutaneous injection. You're giving yourself, we teach you how to do this. The key is you start on a low dose, and then you slowly increase monthly as needed. And then monitoring your weight monthly, monitoring your appetite, making sure you're not having any side effects, and then monitoring your metabolic health labs roughly every 6 months, at baseline every 6 months, to make sure things are being done safely and appropriately. So there are very compelling results from the clinical trials for weight loss for semaglutide. What you find is that people are getting on average 15+% weight loss in these kind of studies. And these are studies that are looking at this over longer term, meaning not just for a few months, they're looking at this at 2+ years. They're finding that there's good, not only results in terms of weight loss, but these are also generally very well tolerated in the vast majority of people. Combined with good nutrition and regular exercise, we know that this can give you a better and maximize and optimal results to help keep you healthy as much as possible. In terms of potential safety issues, when you look at the potential issues with semaglutide and tirzepatide, generally speaking, these have a very good safety profile long term. Now, the reality is that any intervention that you do in somebody, there's always a small but potential risk of side effects. All right. And so the most common side effects with these kind of peptides are some mild gastrointestinal issues like nausea and constipation that can be more severe. But really the keys are you start on a low dose, see how well you're tolerating it. If you're tolerating it and it's working, then if needed, you go up on the dose. If you're not tolerating it, either you reduce the dose or you switch to a different peptide, right? So the keys here are to take small steps, carefully observed and managed by us, and so that we can help do this in a really effective way and a really safe way. The other exciting kind of weight loss one that we're utilizing are lipotropics. These are substances that help in the breakdown of metabolism of fat in the body. So in the lipotropics that we utilize, there's a few different ones. There's vitamins, supplements, and amino acids that are listed here. The benefits of lipotropics are improve your energy level, and show the help with liver detoxification, aid in weight loss, potentially help with heart health, enhancing mood and mental clarity, supporting hormone balance, boosting your overall immunity, and improving your joint health as well. I happen to use this as well, and I can definitely say that it definitely helps with energy level. What's nice about this is that For folks who either cannot tolerate or don't want to utilize a peptide treatment, this is another option that's available. What we're trying is actually sometimes combining the lipotropics with the peptide treatments to see if we can get an even better result for folks. With lipotropics, again, it's a self-injectable. You inject yourself intramuscular once per week. We'll show you how to do that. Not very hard to do. You'll be able to do it. Again, we think combining this with peptide treatments can really help with weight loss. Again, they work by helping to mobilize your fat from the adipose tissue, enhancing your liver's ability to metabolize fats, supporting your overall liver function to remove fats and toxins from the body, and even to reduce cholesterol levels by promoting conversion of cholesterol into bile acids by the liver. And lastly is health coaching. So we're working with an organization called Flair Health to help us out with nutritional health coaching. I think the benefit of health coaching here is, number one, from an education standpoint, very helpful in terms of making sure you know what are the right things to do. Sometimes we assume everyone knows the right things to do, but it's helpful. It's definitely helpful to make sure everyone's on the same kind of level. And number two is accountability. The reality is you can know what's right to do, but actually doing it is sometimes hard. And actually being accountable to a health coach is very useful in terms of making those changes. And then, of course, there's creating new habits. It's been estimated that creating a new habit can take up to 90 days, sometimes even more than that, to really establish if you're doing it diligently. And I think health coaching is helpful in that if you're trying to make dietary changes, exercise changes, it's helpful to have someone hold you accountable and hold you to that for several months to make sure you're really on point. More than anything else, the keys to optimize treatment, my sense is that peptides, lipotropics, exercise, and nutrition are really going to help the most with your weight loss goals. Nutrition, the keys are eating nutrient-dense foods, avoiding overeating. When it comes to exercise, it's doing both cardiovascular exercise to help with weight loss and improve your metabolic health, and to also do strength training to help protect from muscle loss. Also keep in mind that if you maintain your muscle mass or improve your muscle mass on its own, that helps with weight loss as well. All right, good. So before we kind of move on to some frequently asked questions, I see somebody asking a good question about do the supplements have to be in shot format? You can get most of these separately, not all of them. Some of the amino acids are going to be hard to get. I think it's hard to get them. You're not going to get them all in one pill. That's the thing. So I think if you're open to taking multiple pills, then that probably is fine. The other thing to keep in mind is that there's a difference between the availability of those vitamins and amino acids if you take them via tablet form versus if you take it via injectable form. You're going to get a better absorption if you're doing it via injectable form. And so I think the tablet form can be useful, but the results are going to be a little bit more mixed. It's not going to be as consistent. But very good question. So frequently asked questions that we hear. First question is always, how long before can you see weight loss? So most people who are taking the peptide should notice some early weight loss in the first month. Keep in mind that what we tell people is take it for at least 3 months to see how well you're going to tolerate it. The key is that you're starting on a very low dose, right? And so you're going to notice some differences in terms of appetite and weight loss that first month. But generally speaking, you have to increase it a couple times. And realistically, the lowest dose is, let's say, at 1, the highest dose is at 10. So we start at 1 from a safety standpoint to see how well you're going to tolerate it, and then slowly creep it up. And so that's the right way to really do this. Next question is, how much weight can you expect to lose? On average, 15 to 20%. That's what the studies show. That's realistic. I think if you optimize your nutrition and your exercise as well, you can even do better than that. How long do you need to continue treatment? What we recommend to people is initial period, try to aim for at least 6 months. The studies show that the peptide treatments are most effective for chronic weight loss management. And what that means is that if you reach your weight loss goal, you may not necessarily need to stay on the full dose long-term. Maintenance dosing can be lower either in terms of dosage or in terms of frequency. So you may not necessarily need, once you've hit your weight loss goal, you may not necessarily need to take the treatment every week. You may be taking it every 2 weeks. I don't think I have too many people asking me this now, but do I need to eat healthy and exercise when using these treatments? This is one of those questions that I don't think you really need a doctor to tell you, do you need to be eating healthy and exercise? So yes, you absolutely should be doing that. Just common sense would say that. But the thing is that the results show that with treatment, with semaglutide or tirzepatide treatment, that you get a better result if you can also eat and exercise, eat healthy and also exercise as well. So we know that semaglutide can help you establish better eating habits. And if you're someone that's trying to instill newer habits, even in terms of exercise, this can help you out with that as well. So, can semaglutide make your muscle and bones weaker? So, keep in mind that when you lose weight, you lose both fat and muscle. Your body doesn't really know how to differentiate between where it's pulling that from. So, the key is to prevent muscle loss. You want to improve your body composition or maintain it or improve it as much as possible. And so, you want to do resistance exercises, some weightlifting exercises, and the key is that you want to just maintain the muscle mass as much as possible. That's how you can prevent muscle loss. And if you can maintain your muscles, you'll prevent the bones from getting weaker as well. And then, of course, optimize your nutrition. Eat healthy things to maintain your muscle and bone health as well. Interesting question I've gotten from some people. I already don't eat much. Will treatment still help? Yes, a couple of reasons. Number one, peptides can still assist with your metabolic health, all right, in terms of how your body is handling blood sugar. Number two, just if you're not eating a lot, are you eating the right things though? Right? Are you eating the wrong things? So if you want to stop eating the wrong things, semaglutide can actually help out with that. And the other thing is that the lipotropics, separate from the peptides, can also still be beneficial in people who maybe do not consume as much as it is already. If you stop treatment, will you regain all the weight? So the studies show, it's a very strange study. It shows that if you stop semaglutide and if you stop eating healthy and stop exercising, then on average, you'll regain 2/3 of the weight loss as possible. So, number one is you don't regain all the weight. But number two is, why would you stop eating healthy and exercising? That is clearly the key long term. So, I would say if you stop treatment, just make sure you're still doing the right nutrition and exercise things that are key for your health long term anyway. So should you use peptides long term? Say yes, it can help you maintain weight loss and your metabolic health. The metabolic health is actually a humongous issue. Like I realize that we're focusing really talking about weight loss, but the metabolic health is the thing that really helps to prevent or prevent diabetes, blood pressure, heart disease, strokes, right? Like that's a different order of magnitude of medical concern. The other thing is that the safety studies to date look really good when you talk about 2+ years out. And again, the maintenance dose may be lower in dosage or frequency if you're using this long term. And then, of course, how do peptides compare to other prior weight loss meds? There's been a lot of excitement about weight loss meds in the past. The thing is that, number one, the peptides actually lead to more weight loss and more consistently than the prior meds. And number two, the prior meds, they had other issues, right? Like more significant issues, sometimes even cardiac issues. And the peptides seem to be safer as well. I think in large part that's because they're actually working on the pathway that your body is already using. So our comprehensive physician-assisted weight loss program, we're offering you a personalized approach to weight management, utilizing the efficacy of peptides and lipotropics, starting with a thorough evaluation, making sure that we understand your medical history, your weight loss goals, any other kind of underlying health conditions, doing this safely and correctly to begin with. Expert physician management, our team of experienced clinicians will guide you through the entire process, providing personalized treatment plans and ongoing support. The reality is that this is not just a one-size-fits-all process. You have to tailor treatment appropriately to the person, the patient, so that they get the right results safely. And then, of course, continuous monitoring and adjustment, closely monitoring your progress, adjusting your treatment plan as needed so that we can do this safely and effectively. And then, of course, from a safety standpoint, checking your metabolic health labs every 6 months to make sure that you're an appropriate candidate, to make sure that this is being done safely and we're not potentially hurting you as well with treatment. So our comprehensive weight loss assisted program, offering personalized approach to weight management, utilizing the efficacy of peptides and lipotropics. Peptide therapy starts at $450 per month. Lipotropics start at $150 a month. That's if it's done separately. If it's combined, that's a lower pricing. There is bundled pricing. And this all includes medical monitoring, medications, and supplies. And if you would like to learn more about our peptide weight loss program or join it, you can either go to the website that's listed, or you can actually you can take a picture of the QR code that'll take you to the our peptide weight loss link as well. Okay, here's a good question. Somebody asking about tolerance for the drug. Does that improve over time? If you get nauseous with a small dose, is it possible that your tolerance will improve? Yeah, good question. So yes, short answer is yes. Like each person's a little bit different, but short answer is yes. In that, if you you start on a low dose and you see how you do for a few weeks, and for most people, they may notice a little bit, tiny bit of like GI symptoms, very small, and for most people, their body will get used to it. And if they're getting used to it, that's when we'll start to increase the dosage if we need to do that. The other thing is that there's other versions of peptides besides semaglutide. And so tirzepatide is sort of the next level, which it's a little bit better tolerated from a GI side effect. We generally recommend semaglutide first line for a couple of reasons. Number one, it works well in the vast majority of patients. Number two is that it is a little bit cheaper as well. And number three is that it's got more time that it's been used than really anything else, any of the other peptides that are on market right now. And so there are options if you are having side effects, and there are options if you need to use something else. Okay, somebody else asking about, just to be clear, this is not Ozempic, correct? Okay, so somebody asked about Ozempic. So this is, semaglutide is the generic version of Ozempic. And, when you look at the data for Ozempic, the vast majority of people are doing very well with it without much side effects. Now, the nature of any treatment is that if you give it to tens of millions of people, you're going to have a few people that are going to get side effects, more significant side effects. And so that has happened with Ozempic as well. And the key there is that you need to be monitored safely and appropriately. I think if your dosing is going too high too fast, that's when people can get some bad side effects. If you're not being observed carefully, right, each step of the way, that can lead to side effects as well. But the nature of like medical management is that you do things in a very focused, cautious, stepwise fashion, so that if someone is developing problems, you immediately react to that and you prevent it from becoming a big problem. And I think in the cases where people have had bigger problems with Ozempic, it's really been in cases where they were not being managed appropriately. Great questions. I'll kind of pause for one moment to see if there's any other questions before ending today. But, overall take from a medical standpoint is that semaglutide and the peptides are really changing not only weight loss, but our understanding and our ability to help out with metabolic health issues. And that's exciting because that is really the key to improving overall health, I think, here in this country for sure, which is improving metabolic health. And as someone who sees a ton of people who've got lower extremity arthritis and pain issues, I think the idea that you can make a huge difference in somebody's life just by reducing weight, I think has some added benefits as well. Wonderful. Well, if you'd like to be in touch, you can contact us via that link. In the chat section, you can see our phone number, our email address, and even you can actually schedule directly into our schedule as well. Oh, okay. Actually, here's a question. Great question. Okay, so a couple of questions that are coming from our social media channels. Somebody asking which GLP-1s do we offer? So we're utilizing semaglutide and tirzepatide for our GLP-1 inhibitors, or GLP-1 agonists. Somebody else asking, okay, that's unusual. Somebody's saying that semaglutide gave them more wanting to eat. Specialists, sweets, I gain. Okay. I think if you're having a atypical effect, so somebody's saying that they're feeling more hungry, that's unusual. I can't say I've really seen anyone say that they're feeling more hungry. I think everyone that I've treated for this says that their appetite definitely goes down. But I think the health coaching part is a key part of this as well, namely because I think in changing habits, changing behaviors, I think that takes time as well. The other thought is, maybe semaglutide is not the right treatment for you. Tirzepatide might work differently, right? It does work differently. And so that might be another option for you, even if semaglutide did not give you the result that that was expected. Yeah, some good questions. Okay, great. Okay, somebody asking about, okay, good question. One last question, someone typing in, someone asking about insurance coverage. Yeah, so the FDA covers semaglutide and tirzepatide, or has said that it's approved rather for diabetes and weight loss. And I kind of gave the indications for weight loss, either based on BMI or lower BMI, but if you still have other weight-related comorbid conditions. Insurance is really only covering this for diabetes, and even in diabetes, they're not covering it. You have to fail multiple things before you can do that. And so getting this covered by insurance for weight loss is not occurring at this point. This is really for weight loss primarily. This is currently mainly a insurance. It's outside the insurance system. It's an out-of-pocket payment. If you do have diabetes, however, and you have the chance to take this, definitely talk with your primary doctor and see if you can kind of kill two birds with one stone here, right? Can you treat not only the diabetes, but can you also treat your weight loss goals as well? Great questions. Okay, wonderful. Well, thank you everyone for your time. Until we connect again, I hope everyone stays healthy and stays safe out there. All right, have a good day and live well, everyone. Bye-bye.